invite Dr. Suchana Marahatta to give her presentation on an experience on atrophic acne scar treatment from Nepal. Koirala Institute of Health Sciences, Nepal. Dr. Suchana.
Hello.
Hello, Dr. Suchana.
Hello, yeah. Thank you so much. Can I start?
Yes, please.
Yeah, okay. Do you have the presentation?
Okay.
Or should I share my screen?
If you please, would you share yours?
Yeah, I'll try, yes.
Okay, thank you.
Is it visible? Hello?
Yes, Dr. Suchana, please proceed.
Yeah, thank you so much. Thank you so much for this opportunity. I feel extremely overwhelmed to be a part of this academic endeavor. And many thanks to the organizing committee. I feel very happy to present my experience from my workplace. Yeah, I'm currently in my OPD itself. So now let's move on with my presentation. Just a second. I am just trying to make it in the slides view. I'm sorry for the technical issues. Just a second. Just a second. Allow me a few minutes.
Okay.
I am not able to make it in the PPT view. That's why. I am not able to change it from this thing. Can you help me in technical assistance? Can someone help in this regard to change my slide? Hello?
Yes.
Can you help me to change my slide? I'm not able to make it from my...
Slideshow is not working?
Yeah, it's not working.
Could you press F5?
F5, okay.
Yes.
Yeah, F5. F5. F5, yes. Will it work? Still not working.
Okay, do you have function button?
Function?
Yes, function and F5 together.
Function and F5 together. It's also not working. Yeah, is it working? No, it's
Dr.
not.
Suchana?
Yes,
Sorry
yes,
for
please.
the interruptions. Can you click the slideshow on the top of the screen is showing, right? Slideshow.
From the Zoom itself?
No. It's showing like design, transitions, animation, slideshow on the top.
Yeah.
Click on the slideshow.
Actually, the Zoom icons are there. So I'm not able to push. Let me try. Yes, slide. So yes. No, it's not working. Probably it's because of Zoom icon already there.
Okay. Can we share your PPT?
Yeah, I have already shared my screen and I have already emailed the PPT to the committee. So if you can play from there.
Yes, we'll do it for you, doctor.
Okay. Thank you so much.
Is that visible, doctor?
Yeah, it is visible. Yes.
Yes, you can start your talk, doctor.
Yeah, thank you so much. Yes, again, thank you so much, organizing team. May I have another slide, please? Yeah, I am just going to share my experience on atrophic acne scar treatment. I am associate professor in dermatology at Nepal. So this is just my introduction. Next slide, please. Yes, we know acne is very common condition, and it's found that almost like 90% of the adolescents are suffering from acne itself. And it is found that in various studies, about 95 to 100% of the boys, adolescent boys, and 83 to 85% of adolescent girls, they are suffering from acne. And almost 5% of the older adults are also getting acne. So this is very, very common problem. And acne scar is actually a very distressing condition, and it can result into decreased self-esteem, reduced quality of life, and very, very negative impact on their daily activities. That's why it's very, very important to take care of this acne scar. Even though acne is going to settle on its own, the scar will be a permanent damage to individual. Next slide, please. Coming to the acne scar, there are various types of acne scar. The commonest one, some of them are very common type. One of them is ice pick acne scar. It is characterized as narrow, less than 2 millimeter in depth, but it is quite sharply marginated epithelial tract, which extends vertically to the deep dermis and subcutaneous tissue. Okay, and the surface opening is usually wider than the deeper infundibulum. Next slide, please. Next slide, please. Yes, as shown in the picture, no, that's previous one, yes. As shown in the picture, the ice pick acne scars are wider in the opening, while having narrow end at the deeper skin. So we can see the pictures of ice pick acne scars. Next. Other common scar is rolling acne scar. Rolling scars are basically because of the dermal pulling of the skin. Okay, it is because of dermal tethering of otherwise normal, relatively normal appearing skin, which is generally wider than 4 to 5 millimeter, and there is abnormal fibrous band pulling the skin, pulling the epidermis of the skin from dermal and subcutaneous component, which leads to rolling appearance of the overlying skin. Okay, and the correction of subdermal components which is tethering below, that is very important during the treatment of acne scars, this type of acne scars. Next, please. Yes, this is picture of rolling scar. It is like somewhat normal epidermis, but there is a fibrous band underneath in the subcutaneous and dermis. That's why giving this type of rolling appearance. Next, please. Yes, box scars are round to oval depression. They are like 1 to 4 millimeter in diameter with sharply marginated vertical edge. Okay, they looks like varicella scar, and they are clinically mostly wider than other type of acne scar, like as compared to ice pick acne scar, they are wider as well as deeper. Okay, next, please. Yes, this is how the box scar acne scar looks like. We can see in the picture they are wider, okay, and they are sharply defined with sharp vertical edge, and they can be deeper as well as superficial. The deeper box scar acne scars are most difficult to treat. Okay, next, please. Yeah, this is like common type of acne scar which I've already told. This is ice pick acne scar. Ice pick acne scar looks like this in the actual. This is rolling scar, and this is box scar. So this is how there is difference between different types of scar. And in rolling scar, there is mostly abundant fibrous band beneath the scar. in the dermis, as well as extending up to the subcutis. Next, please. Yes. Treatment of acne scar is actually very difficult because scar treatment, we have got very limited option, and it's not possible to have 100% result, even though we try our best. Okay, so acne scar treatment should be individualized. There should be several sessions, multiple sessions for a single patient, and there can be multi-modality treatment. So if we rely only on a single treatment modality, it may not be sufficient for an individual. So we need multiple modalities of treatment for a single patient to have an optimum outcome. Next, please. Yes, if you see in this picture, ice-pick scars, basically, what can we choose? What treatment modality can we choose for the optimum outcome? So depending on the various recommendations, various research and trials, ice-pick acne scar, basically, the best treatment would be Pons excision. Even TCA cross has been found to be very effective for ice-pick scars, and also radio frequency, and then laser skin resurfacing or various laser treatment would be a better choice for ice-pick scar. Similarly, for rolling scar, subcision is found to be a good modality of treatment, along with filler treatment, dermabrasion, microneedling, and to some extent, even radio frequency and laser resurfacing would help for the rolling scar. Next, please. Yeah, for the box scar, acne scar, if they are shallow or superficial, Pons elevation, dermabrasion, microneedling, radio frequency, and laser resurfacing can be helpful. And for deep box scar, they are actually very resistant to treatment, but still we can try subcision, TCA cross, Pons excision, elevation, and laser resurfacing, even in box scars. Next, please. Yeah. Now moving to the various modalities of treatment in little bit depth. I have been practicing subcision since many years, and I think this is a best modality, one of the best modalities available for acne scar treatment, and which is very cheaper, and even people from marginalized people and poor economic background can also easily afford this type of treatment. So I have been practicing subcision since many years. And actually, if we go back to the history of subcision, it's a simple surgical procedure which was initially described in 1995 by Oren Trace. It helps to detach the tethering fibrous band, which is there, which is pulling the epidermal part deeper into the dermis. Okay, so this is a very simple modality, easily available even in resource poor setups. So we can always opt for subcision in our acne scar patients. Next slide, please. Yes, what does subcision do? Basically, as I have already told, there are basically fibrous bands. Okay, in most of the acne scars, there are fibrous bands below the epidermis, extending from dermis even up to the subcutis. So even though we do many resurfacing, if we don't break this fibrous band, it's not going to give optimum outcome. So subcision is such a modality where we can break this fibrous band, which is there in dermis, extending to the subcutis. So this is a pictorial diagram of subcision. Next slide, please. Yes, again, how subcision works. This is the plane where subcision is done. I'll discuss with the instruments later on. Yes, here we break the fibrous band with various instruments. And what will it lead to? So how it will help? So there will be formation of controlled formation of hematoma, microhematoma. Okay, there will be artificial injury and then followed by microhematoma in the dermis, in the layer of dermis and just below the dermis. Okay, upper dermis as well as just below the dermis, dermal and subcutaneous layer. So this hematoma will lead to formation of it will enhance the wound healing process, generation of multiple growth factors, and it will help the neocollagenesis, okay, neocollagen formation, so that there will be enough collagen to replace the fibrous band with neocollagenesis. Next slide, please. Yes, this is commonly used instrument. Most of the people, they prefer 18 gauge Nocker needle, which is a triangular needle, okay, which is a triangular needle. But if this is not available, we can also go for hypodermic needle. We can use 14 gauge hypodermic needle. This is how the tip of hypodermic needle looks like. And instead of Nocker needle, we can just use this hypodermic needle to break the fibrous band. Okay, next slide, please. Yeah, so during the procedure, we should clean the area, we should tape, and then local anesthesia is the must because this is a painful procedure. So local anesthesia is given. It can be given in two ways. I personally try both of these procedures, in both ways, like one with the field block with the insulin syringe, and sometimes I block the field with long spinal needle as well. Okay, so we can try in both the way. We can give local anesthesia over the affected area in both the way, and then once the area is anesthetized, I insert the hypodermic needle initially at the 45-degree angle, and then later on it's inserted parallel to the skin surface, and then fanning movement is done all around. And then while having a fanning movement, we can hear a particular sound, okay, crackling sound, somewhat which is because of breakage of fibrous band, which is below there in the dermis. So this is a particular sound which we can hear while doing the fanning movement of the hypodermic needle. And once the needle is removed, we should squeeze the blood from all around, because if we leave it just like that, there can be quite a lot hematoma formation, leading to a bluish discoloration. So we should, and also there will be chances of secondary infection and all because of excess hematoma formation. So we should squeeze the blood from all around the plane which the area which was undergone subcision. Okay, this is very important point. Next slide, please. Yes, and post care, it is like very simple. We should give systemic antibiotic and then topical application of antibiotic and sometimes painkiller for 2-3 days. And then we should go for subcision at around like 4 weeks interval for 3 to 4 sessions. This is like optimum subcision session. 4 to 6 weekly interval and 3 to 4 session for at least 3 to 4 session, which I regularly practice. Okay, next please. Yes, it is found that I have never done subcision alone in acne scar. I always do subcision along with other modalities of treatment. Okay, when I tried subcision with microneedling, actually among 15 patients which I have recorded, it was found that quite good, excellent response was there in 55% of the patient. Good response was seen in 34% of the patient, and poor response was seen in among 11% of the patient. And if we see the acne scar outcome with various modality, this is very good outcome. That's why we can always combine subcision for treating acne scar. That is my personal opinion. Okay, next slide, please. Yeah, now moving to the next modality of treatment, which is also very easily available. Okay, so as I have worked for a longer duration in a medical college setup where affording people are quite less. So I have tried to simplify my treatment with in a cost-effective way. Let's say in cost-effective way, which are cheaper, easily available in resource poor setting. So I've tried in that way. Microneedling is also a very cheaper modality of treatment in our part. And how does it work? It basically works with, it basically stimulates again collagen formation. It causes neocollagenesis. Collagen induction is there by controlled micro injuries. Okay, there will be a micro injury with the help of microneedles in microneedling, as the name given, which stimulates body's natural wound healing mechanism, leading to neocollagen formation. That's how microneedling works. And this would be also one of the good modality for the acne scar treatment, because again, there is deficiency of collagen in all these type of atrophic acne scars. Next, please. Its advantage of microneedling is it is quite a natural way of skin rejuvenation, and it uses skin's one capacity of rejuvenating capacity, and it creates micro channel that can be even combined for the topical product use while doing the procedure itself. Like I generally use a C serum as well as hyaluronic acid serum while doing the microneedling, so we can directly deliver this type of topical agent into the skin while doing this procedure. So it has got added advantage as well. Next, please. Yes, what is the microneedling? It is actually, we have got a variety of instrument available for microneedling. The initial primitive microneedling was initially started with a roller. It was a concept roller having 192 fine microneedle in 8 rows, ranging in depth from 0.5 to 1.5 millimeter. However, generally for acne scar division, I use 1.5 to even maximum 2.5 millimeter roller, that the length of the needle. And then diameter of the needle is 0.1 millimeter. And microneedles are basically synthesized with a very good stainless steel, using stainless steel and silicone or medical grade steel. So that's why it's very safe to try on our skin. Next, please. Yes, these are the various instruments. The smaller one can be used for the difficult areas like around the nose, around the eyes, and other can be used for the other part of the face. Okay, next, please. Yes, this is a newer development in microneedling. These days, various type of pen are available, like microneedling pen are available. One is like M pen, Dr. pen, Derma pen. So I've been using M pen as well as Dr. pen these days. Next, please. Yes, this is how the M pen looks like. Dr. pen is also somewhat similar, but with a wire connected. But M pen is free of wire, and it has got needle tip at the multiple needles at the one end of the pen, and wireless works with a battery, and we can control various speed with which is given in color codes at the end of the pen. Next, please. Yes, the advantage of pen over derma roller is derma roller basically creates a larger or a bigger epidermal injury at the surface, whereas the Dr. pen or M pen or this type of pen, microneedling pen, creates very minimal epidermal injury, and it can create a deeper and very regular dermal and dermal injuries. Okay, that is what is needed in our case. So that's why lesser epidermal injury, but uniform and deeper dermal injury. That is the advantage of microneedling pen. So this is better choice if we have to choose among derma roller and microneedling pens. So this is the pictorial diagram, how it differs when we do microneedling with the derma roller and then with microneedling pens. So this is a newer development in the field of microneedling. Next, please. Yes, how we do the microneedling? It's basically we initially disinfect the area, and then we apply the topical anesthetic cream for at least 45 to 60 minutes prior to the procedure. And then again, we clean the area, drape the area, and then do the micro needling in various direction, basically in vertical direction, horizontal direction, oblique direction, till the pinpoint bleeding is seen. Okay, so this pinpoint bleeding is the end point of the procedure. So once uniform pinpoint bleeding is there, we can say that there is optimal microneedling. After that, we stop stop that particular station over that site. And then similarly, if we are using the microneedling pin, we can adjust the depth of the microneedles. Okay, so around the eye, around the nose, we can go to the minimum depth like 0.25 to 0.5. Over the forehead, 1 mm will be sufficient, whereas over the cheeks, like 1.5 mm is sufficient. And if there are deeper acne scar, we can go even up to 2.5 millimeter. So this is how the advantage of microneedling pain is. We can adjust the depth of the needle depending on the site and depending on the requirement over that site. Okay, and after that, we should cold compress the area and then apply the topical antibiotics. And post-procedure care, definitely we have to explain the individual to avoid sun exposure at least for 5 to 7 days. It has the downtime of around 5 days. And we should explain that prior to the procedure. And then very, very effective sun protection is needed, and topical antibiotic, as well as sometimes topical, systemic antibiotic is also given after the microneedling. Next, please. Yes. In my personal experience, I found that when we evaluated 21 patients, we found that almost 45% of the individual have excellent response with microneedling. This is microneedling alone therapy. And then 49% individuals showed good response, and 6 individuals, they showed poor response with microneedling alone treatment. Okay. However, if we see other studies, it was found that in one of the study, almost 71%, 71.4% of the individual had excellent response, 25% of the individual had good response, and 3.6% of the individual had poor response in atrophic acne scar when they tried in all type of acne scar. This was quite impressive result, while in our context, we could not find that optimum result, but still quite acceptable result, even in our context. Next, please. Yes, in another study, which was, in another study, it was found that it was like the response was a little bit lower than in our case. In that study, 16.7% of the people have excellent response, 50% had good response, and 33% had poor response in case of acne scar in their particular study published in Journal of Chinese Aesthetics and Surgery. Next, please. Yes, laser resurfacing is another very popular modality. This is also somewhat similar to microneedling. We generally practice fractional laser, and its mechanism is somewhat similar to microneedling because it takes a portion or a fraction of affected skin, leaving behind like intervening normal epidermis in between. Okay, so that will help in the rapid reepithelialization of the skin. Okay, its adverse effect is quite less, recovery is quite fast with fractional laser. That's why these days fractional laser are also quite popular option for the acne scar treatment. Next, please. Yes, as shown in this picture, this laser, they will help, they will create a channel like this. Okay, so they will work on this particular area, leaving behind the normal skin in between. So this will help in rapid reepithelialization, and the deeper depth, we can control the depth with this laser also. So we can reach to a deeper surface with the laser resurfacing. That is definitely advantage of laser resurfacing, but it may not be available in all setup. So that will be a disadvantage of this laser resurfacing. Next, please. Yes, I generally practice with these parameters. Parameters may vary from individual to individual and different types of acne scars also. This is generally, I generally try with fluence 15 to 25 joule per centimeter square, ablation depth being 1 to 1.2 millimeter, and double pass setting in double pass setting. Generally, we need 4 to 6 sessions. 4 to 6 weeks apart. Okay, that is generally recommended treatment session for acne scar. But in my personal opinion and personal experience, even microneedling is equally effective as compared to the laser resurfacing. I have just recently started using laser resurfacing, but microneedling is quite promising and cost-effective way of treatment for acne scar treatment. Next, please. Yeah, in some of the studies found that excellent and good result was found in 43% and 25% of the patient respectively with laser resurfacing. And excellent outcome was found almost 50% of half of the individual in one of the study done in Asian skin. So this was the finding with the laser resurfacing. I do not have actual record of the patient till now because they are still in the process because I've just recently started using laser resurfacing. But still, I always choose microneedling over laser resurfacing because of the cost factor. Next, please. Yes, combination treatment is again very, very important because we should not rely on single modality of treatment for various acne scars. Next, please. Chemical peel is another promising modality of treatment as a combination therapy. It's found that chemical reconstruction of skin scars, commonly known as crush, okay, using 100% trichloroacetic acid for ice pick type of acne scar. It can be done at 2-week interval for 4 to 6 sessions. There was actually one study done in India. It was found that 70% of the individual had, yes, out of 10 patients, 8 patients had 70% improvement with cross therapy, chemical reconstruction of skin scars using 100% trichloroacetic acid in that particular study. And we can also go for salicylic acid, 20 to 30% salicylic acid, Jaschner's solution, modified Jaschner solution, 20 to 30% trichloroacetic acid peel for acne scar, especially for macular type of acne scar and superficial type of atrophic acne scars. Next, please. Yes, platelet-rich plasma therapy is also becoming very popular these days, and I personally try to combine this therapy along with other modality of treatment like microneedling and laser resurfacing. It is also found that this also gives a quite impressive result. And if patients are willing to afford, I always try to combine this technology, this particular technology, with other technology available. Next, please. All this type of procedure, if before undergoing this procedure, it's always better to prime our patient at least 2 weeks prior to the procedure, and preferably if possible 4 weeks priming will be better. Priming can be done with various type of agents like topical retinoic acid, topical vitamin C serum, and topical depigmenting agent, especially for pigmentation prone skin. We should start depigmenting agent prior to this procedure because there can be chances of post-inflammatory hyperpigmentation. So we should always prime our patient 2 to 4 weeks prior to the procedure, and we should always explain them about the expected outcome, and if they are having unrealistic expectation, we should never go for these procedures. And we should always assess in detail for keloidal tendency of the skin, active herpes simplex infection, and we should avoid the procedure in case they are having these conditions like keloidal tendency. And if there is active herpes simplex infection, we should go for the acyclovir therapy, and we can postpone the session of these therapeutic modalities. And we should always try to maintain the photographic record along with signed consent form after explaining everything in return, verbally as well as in return. Next, please. Yes, these are some of my results. We tried subcision and microneedling in this particular patient, and this is after 3 sessions of subcision and microneedling session. Next, please. Yes, in this particular patient, we tried just microneedling, and we can find a good improvement after, this is after 4 sessions of microneedling in this particular patient. We can see quite a lot improvement after 4 sessions of microneedling. Next, please. In this particular patient, again, we tried microneedling as well as subcision. So combining subcision depends if there are quite a lot of box scars and rolling scar, we go for subcision. And if there are just pitting scar and quite a few number of rolling scar and box scar, I generally do not combine subcision with microneedling. So in this particular patient, we tried both microneedling and subcision. This is after 3 sessions of microneedling and subcision in this particular patient. Next, please. This result in this patient was just with microneedling alone, just after 3 sessions of microneedling in this particular patient. Next, please. Yes, basically at the end of the presentation, I always would like to emphasize that individualized treatment is very, very important, because we cannot fix, this is the procedure for this type of acne scar. We need to individualize the treatment depending on the number of acne scars, predominant number of acne scar. We can choose the combination of treatment. Basically, combination therapy is always very important, because single modality of treatment is less likely to give optimum outcome. And I always recommend to use subcision for rolling type of acne scar. With it has got a very good result in rolling scars. TCA cross is a good modality of treatment for atrophic ice pick type of acne scar. And then scars are basically can be dealt with subcision and combined with this thing, microneedling and fractional laser resurfacing, but they are definitely very difficult to treat type of acne scar, so we should counsel our patient accordingly. Next, please. Yes, this is the end of my presentation. I would like to thank the organizing committee, Scientex Conference, for this excellent opportunity, this very good opportunity for me, because I could share my experience with you all. I will be very happy to share my further experience. If you have any queries, I will be happy to answer. Yeah, thank you, organizing.